Welcome back. It's Wednesday and we're keeping an eye on your health. Today we're talking about something that's very topical right now in the news is measles and vaccinating as opposed to not.
Correct. I mean, we're talking about this now because of the outbreak in Disneyland of measles. And, you know, let's talk about the measles virus. It's a virus, and like many other viruses, it causes a fever, it causes rash, and lots of viruses do that. But what we're worried about here is the complications of measles. It can lead to the worst complications.
Absolutely.
It's one of the most contagious viruses in the entire world. It has a 90% transmission rate.
Oh, wow. So there's a vaccine. Let's talk about the vaccine.
Exactly. So the vaccine is the only way to prevent measles. It's the only way to prevent measles. And the thing with the vaccine is that it's 97% effective. So if you give the 2 shots as recommended by the CDC, it's at 6 to 12 months and then at 4 to 6 years. So if you give those 2 shots, you're about 97% set. And those rare cases that do get measles, they're still at least partially protected. So this measles vaccine does work. It's great. It's the MMR vaccine, the measles, mumps, rubella vaccine. And what it does is it goes into your body and it creates antibodies or fighter cells to fight off that measles virus if you are exposed to it.
Okay.
Because again, remember, this has a 90% transmission rate, this virus. So if you walk into a room with measles and there are 10 people in that room, 9 out of those 10 may get measles.
Right.
So
well, and you know, parents want the best for their children, and we want the best for your kids. So, in your professional opinion, absolutely get the shot.
Yeah, I mean, you know, there's a big anti-vaccination movement.
Yeah, there is.
And the issue here is this. And I mean, let's look at the science. In 2000, we nearly eradicated measles from the United States, meaning all cases of measles came from people who traveled to another country. Now we're seeing cases like in Disneyland, you know, in the United States, and the issue here is the whole issue of herd immunity. So let's say we are all a herd of people, okay? And what happens if we walk into a herd and someone's not protected, they haven't gotten the vaccine yet, they probably won't get measles because the whole herd does not have measles.
Right.
But once people start skipping vaccinations, a few people in that herd get measles, and then all of a sudden it becomes a problem in the United States. And you know, this has implications. I mean, the science of it is, if I give you a measles shot right now, you will probably get a sore arm.
And I would much rather have the sore arm as opposed to going blind.
Yes.
Or something.
And let's talk about the worst case. Maybe the needle caused a puncture in your skin and you get a little infection. We can treat that too. But we're comparing this to, like, you know, measles, mumps, rubella, the complications I talked about earlier, death, and even the mumps. We have to follow the science, and the science shows there is no harm other than the sore arm and the infection from the MMR vaccine. And again, we all want what's best for your child. I think we should follow science, and there is no debate. I mean, parents, get your child this vaccine. It helps your child, and it helps other children.
Oh, I think that's a good place to leave it right there, Dr. Bose. Thanks.
Thank you.
We're going to take a break. We'll be right back.